Welcome. Today, we're going to walk you through everything you need to know about preparing for a ferritin test. Ferritin is a protein that stores iron in your body, and this test helps doctors assess your iron levels. Whether you're feeling tired, experiencing unexplained weakness, or your doctor simply wants to check your iron status, understanding how to prepare for this test is important. Let's start by exploring what ferritin is and why this test matters for your health. Ferritin is a protein found inside your cells that stores iron and releases it when your body needs it. Measuring ferritin levels gives doctors a clear picture of your body's iron reserves. Low ferritin can indicate iron deficiency, while high levels might point to other health issues. Knowing your ferritin level helps guide treatment decisions, especially if you have symptoms related to iron imbalance. Now, let's look at why your doctor might order this test for you. Doctors may recommend a ferritin test if you show signs of iron deficiency, such as fatigue, weakness, or pale skin. It's also used to monitor chronic conditions like anemia or to check for iron overload. Sometimes, it's part of a routine checkup or before starting certain medications. Understanding the reason for your test can help you feel more at ease and prepared for the process. Next, let's talk about how the test is performed. A ferritin test is a simple blood test. A healthcare professional will draw a small sample of blood, usually from a vein in your arm. The sample is then sent to a laboratory for analysis. The procedure is quick, typically taking just a few minutes, and you can usually resume your normal activities right after. Knowing what to expect can help reduce any anxiety you might have about the process. Now, let's move on to how you should prepare for the test. For most ferritin tests, fasting is not required. However, your doctor may sometimes ask you to fast for a certain period before the test, especially if other blood tests are being done at the same time. Always follow your doctor's specific instructions. If you're unsure, it's best to confirm with your healthcare provider ahead of your appointment. Next, let's discuss what you should do about your medications. Some medications and supplements can affect your ferritin levels or interfere with test results. It's important to tell your doctor about all the medicines, vitamins, and supplements you're taking. Your doctor may advise you to pause certain medications before the test. Never stop taking any prescribed medicine without consulting your healthcare provider first. Let's move on to what you should eat or avoid before your test. Generally, you don't need to make major changes to your diet before a ferritin test. However, if your doctor has given you specific instructions, such as avoiding iron-rich foods or supplements, be sure to follow them. Eating a normal, balanced meal is usually fine unless told otherwise. If you have questions about what you can eat or drink, check with your healthcare provider for clarity. Staying hydrated is important before any blood test. Drinking water can make it easier for the healthcare professional to find your vein and draw blood. Unless your doctor instructs you otherwise, you can drink water as usual before your ferritin test. Avoid alcohol or excessive caffeine, as these can sometimes affect your hydration status. Wear comfortable clothing with sleeves that can be easily rolled up or removed. This makes it easier for the healthcare professional to access your arm for the blood draw. Avoid tight or restrictive clothing on the day of your test. Being comfortable can help you feel more relaxed during the procedure. Plan to arrive at the clinic or laboratory a few minutes early. This gives you time to check in, complete any necessary paperwork, and relax before the test. Bring your identification, insurance information, and any paperwork your doctor has given you. Being prepared helps the process go smoothly. When you arrive, you'll check in at the front desk. The staff may ask you to confirm your personal information and the reason for your visit. You might also be asked about your current medications or any symptoms you're experiencing. Answering these questions accurately ensures your test results are interpreted correctly. After checking in, you may need to wait for a short time before your blood draw. Use this time to relax and take deep breaths if you're feeling nervous. Reading, listening to music, or simply closing your eyes can help pass the time and ease any anxiety. When it's your turn, a healthcare professional will ask you to sit in a comfortable chair. They'll clean the area on your arm, usually near the elbow, and insert a small needle to draw blood. You might feel a quick pinch, but the process is generally quick and not very painful. Try to stay relaxed and breathe normally. Once the blood sample is collected, the healthcare professional will apply a small bandage to your arm. You may be asked to press on the site for a minute to stop any bleeding. Most people can return to their normal activities right away. If you feel lightheaded, sit for a few minutes until you feel better. It's normal to have a small bruise or mild soreness where the needle was inserted. This usually goes away within a day or two. If you experience swelling, severe pain, or signs of infection, contact your healthcare provider. Most people have no complications after a ferritin test. Ferritin test results are usually available within a few days. Your doctor will contact you to discuss the results and what they mean for your health. If you haven't heard back after a week, it's okay to call your doctor's office for an update. Let's talk about what your results might indicate. Low ferritin levels can indicate iron deficiency, which may lead to anemia if not addressed. Symptoms can include fatigue, weakness, and shortness of breath. Your doctor may recommend dietary changes or iron supplements to help restore your iron levels. It's important to follow your doctor's advice for the best results. High ferritin levels can be caused by conditions such as inflammation, liver disease, or iron overload disorders. Your doctor will interpret your results in the context of your overall health and may order additional tests if needed. Treatment depends on the underlying cause, so it's important to work closely with your healthcare provider. Several factors can influence your ferritin test results, including recent illness, inflammation, or certain medications. Always let your doctor know about any recent health changes or treatments. This helps ensure your results are interpreted accurately and appropriately. If your child needs a ferritin test, preparation is similar to that for adults. Explain the process in simple terms to help them feel comfortable. Bringing a favorite toy or book can help distract and calm them during the blood draw. Pediatric healthcare professionals are skilled at making the experience as smooth as possible. Pregnant women may need ferritin testing to monitor iron levels, as iron needs increase during pregnancy. Preparation is generally the same, but always follow your doctor's specific instructions. Your healthcare provider may adjust your supplements or diet based on your results to ensure a healthy pregnancy. Don't hesitate to ask your doctor any questions you have about the ferritin test or your results. Good communication ensures you understand the process and what your results mean. Your doctor is there to help guide you through every step, from preparation to follow-up care. It's normal to feel a little anxious before any medical test. Taking deep breaths, staying positive, and reminding yourself that this is a routine procedure can help. If you have a fear of needles, let the staff know they can offer support and make you as comfortable as possible. If you feel nervous, consider bringing a friend or family member with you. Having someone there for support can make the experience less stressful. Some clinics may have restrictions, so check ahead to see if visitors are allowed during your appointment. Plan how you'll get to and from the clinic. Most people can drive themselves, but if you're feeling anxious or have had issues with blood draws before, arranging a ride can be a good idea. Make sure you have enough time in your schedule so you don't feel rushed. Bring your identification, insurance card, and any paperwork your doctor has given you. If you have a list of medications or supplements, bring that as well. Being organized helps the appointment go smoothly and ensures all necessary information is available. Let the staff know if you have any allergies, especially to latex or adhesives, or if you have any bleeding disorders. This information helps them take extra precautions to keep you safe during the blood draw. If you have a history of fainting during blood draws, let the staff know ahead of time. They can take steps to help prevent fainting, such as having you lie down during the procedure or providing extra support. On the day of your test, avoid heavy exercise or strenuous activity before your appointment. Physical exertion can sometimes affect blood test results. Light activity, such as walking, is usually fine unless your doctor advises otherwise. Some supplements, especially iron or vitamin C, can affect your ferritin levels. Unless your doctor tells you otherwise, you may be asked to avoid these on the day of your test. Always follow your healthcare provider's instructions regarding supplements. Alcohol and smoking can sometimes interfere with blood test results. It's best to avoid drinking alcohol or smoking for at least 24 hours before your ferritin test, unless your doctor advises otherwise. This helps ensure your results are as accurate as possible. If you have chronic conditions like diabetes or kidney disease, let your doctor know. They may have special instructions for you regarding medication, timing, or fasting. Managing your health conditions properly helps ensure accurate test results. If you've recently traveled across time zones or have jet lag, let your doctor know. Changes in your sleep schedule or routine can sometimes affect blood test results. Your healthcare provider can advise you on the best timing for your test. If you're feeling unwell or have a fever on the day of your test, call your doctor's office. Illness can affect your ferritin levels and may impact your results. Your doctor may recommend rescheduling the test for a later date. If you've recently donated blood, let your doctor know before your ferritin test. Blood donation can temporarily lower your ferritin levels, which may affect your results. Your doctor will advise you on the best timing for your test after donation. After your blood is drawn, the sample is sent to a laboratory for analysis. The lab uses specialized equipment to measure your ferritin levels. This process ensures accurate and reliable results, which your doctor will use to guide your care. Your doctor will explain what your ferritin results mean in the context of your overall health. Normal ranges can vary based on age, sex, and health status. Don't try to interpret the results on your own, always rely on your healthcare provider's expertise. Depending on your results, your doctor may schedule a follow-up appointment to discuss next steps. This could include further testing, starting supplements, or making dietary changes. Be sure to attend all follow-up visits for the best care. Keep a record of your ferritin test results and any related health information. This can help you and your doctor track changes over time and make informed decisions about your care. Many clinics offer online patient portals for easy access to your records. Maintaining a healthy lifestyle supports balanced iron levels. Eating a varied diet, staying active, and following your doctor's advice all contribute to good iron health. If you have ongoing issues with iron, regular monitoring may be recommended. There are some common myths about ferritin testing, such as needing to fast for every test, or that the test is painful. In reality, most people do not need to fast, and the procedure is quick and only mildly uncomfortable. Always rely on your doctor for accurate information. To make your ferritin test experience as smooth as possible, follow your doctor's instructions, stay hydrated, and arrive prepared. Bring any necessary documents and communicate openly with the staff. These simple steps can help ensure everything goes well. Let's quickly recap. For most people, no special preparation is needed for a ferritin test. Follow any specific instructions from your doctor, inform them about your medications and supplements, and stay hydrated. Wear comfortable clothing and bring your necessary documents. These steps help ensure accurate results and a stress-free experience. If you have any concerns before or after your ferritin test, don't hesitate to reach out to your doctor. Whether you have questions about preparation, experience unusual symptoms, or need help understanding your results, your healthcare provider is there to support you. Preparing for a ferritin test is straightforward and can help you take charge of your health. By following your doctor's instructions and being proactive, you're ensuring the most accurate results and the best care possible. Remember, your healthcare team is there to help you every step of the way. Thanks for watching, and take care of your health.